Bismillahirrahmanirrahim. Assalamu alaikum. My name is Dr. Javed Wasim. I am a skin specialist. I would like to introduce a brief introduction about myself. I did my MBBS from Jinnah Medical University, Karachi, and then joined Department of Dermatology in Civil Hospital as a registrar. Following that, I went to UK for my postgraduate education in dermatology under a great legend, Rona Mackie. After I came back, I joined Dow Medical College and Dow University of Health Sciences and Civil Hospital as an associate professor. I'm still working over there. I also went to Miami for a cosmetic dermatology training. Dermatology or skin disease is supposed to be a very neglected and often part of medicine. And people used to shun about it or something like that. But the recent researches and diagnostic techniques and awareness of the skin disease have modified the disease, and it has taken an important place in the family of medicine, because dermatological disease is something you can see and it has an instant impact on the viewer. Other diseases take their time to come. Here I would like to mention that dermatology includes diseases of the hairs, nails, and sexually transmitted diseases like syphilis and a part of cosmetology. Basically, dermatological diseases are divided into two diseases which are very common diseases we hear about every day, such as fungal infections, eczemas, melasmas, which we call jhaiyan in Urdu, excessive hairs, and acne, and like many other such diseases. Other complex diseases which takes place in the patient, like a psoriasis, lichen planus, and lymphomas, they are relatively uncommon, but they are there. I had the blessed opportunity to be associated with Dow Medical College and Dow University of Health Sciences, where I got to see many rare diseases which doesn't reach a common dermatologist. So I think I feel I'm more capable to deal with difficult dermatological diseases. And I also practice cosmetology in terms of Botox, fillers, lasers, but my most emphasis is in treatment of dermatological diseases which are often being neglected. And nowadays, dermatological disease, I told you earlier, are assuming a greater proportion of patients coming to the OPD and outpatient departments. And here I would like to talk about a very common skin disease, which is among the most common seen by any dermatologist. It's called an acne, which is commonly called a pimple and a keel or a muhasa or whatever. There are lots of myths and misconceptions about this disease, and a lot of roadside treatments have been given which have destroyed the skin of the patient. Patient come to me and they can't afford the treatment, but they have a daughter who's got a very severe acne. I tell them, you cut some amount of our dowry, but give her a good face, because in her in-laws, people will look at her face, not how much you have brought from parents. So acne, we'll talk about a better point of the acne. Acne, everybody of us has certain oil-producing glands which are called sebaceous glands. It's in the face, back and the chest. Under the influence of hormone, in adolescence, balugat or maturity, those glands activate and produce a lot of oil. That makes the skin oily, or we call it chickeny. So far, things are all right, and oily skin doesn't constitute a disease. But with that oily skin tends to have pimples, blisters, pustules, and some blackheads and whiteheads, then it's tend to be called an acne or a pimple or a kila muhasa. Here I would like to point out that acne, there is a general conception that acne occurs only on the face. It's by no means true. A truncal acne is a very common perception which can occur on the back, chest and shoulder, and often it is neglected and untreated because people consider it to be a simple infection or something like that. Acne has a certain lifespan, it has to be treated. Besides sebaceous gland, there are certain factors which can aggravate an acne, commonly the drugs, which especially the steroids, the cortisone, the topical and the oral. Here I would like to mention a very sad fact. Everybody is trying to look more and more white, and this has led to a black industry which leads to this whitening creams, and it has destroyed, I personally can vouch, it has destroyed the family, and those mostly contain steroids, and they play havoc with the face or really. Besides the oral contraceptive drugs and steroids and makeup, acne cosmetica, a certain brand is called acne. It's a very common cause, and with stress, young many people can relate. We failed in exam, this happened. So these are remember those factors, especially the cola drink, the medicines, the makeups, the cosmetics, and the cola drink, the fidgeting. They have a lot of that. And besides stress and there are other factors, but these are the four. Remember them. And acne should be treated because treatment is available. Acne has definitely a treatment. There are two types of treatment. One part of the treatment is that it is suppressed for some time until it goes away. The other part of the is a tablet which is called a Roaccutane or tretinoin. It is given for up to 4 months. In 80% of the cases, acne is cured, and the big thing is that this isotretinoin can also help in scarring to a great extent. There is no methodology in the world, there is no process in the world which can get rid of scars. That is the reason we tell the patient to act in time. Once the scars takes place, the treatment of scars become difficult, and obviously drugs may have their own side effects. So I would strongly suggest to go to a dermatologist and seek the treatment for your acne, because it might be a long life blemish, and then despite spending a lot of money, you can't do much about it. So be aware of that. And another factor I just wanted to mention, which aggravates other cola drinks. It contains caffeine, the chocolates, the Coca-Colas, the coffees, and generally all fizzy drinks, they tend to aggravate acne. So aggravating factor again, drugs such as steroid drugs, topically, orally, stress, cosmetics, and cola drinks. These are the common factors. Young men and people tend to avoid it, and they can lead a happy life. My message is to you, please take acne treatment on time. Go to any certified, qualified dermatologist and take a treatment, because once the scar takes place, there is no way which you can get rid of it. And that blemish will be with you all your life. Even those people who are affording it, they fail and they hesitate, they just take an acne lightly. So my message is to you, in your face, in your presentation, in your crown, do whatever you want to do, but at least preserve your face, and the face go with you. And I would like to here point out that South City Hospital has one of the best specialties around. I would recommend you all the diagnostic facilities. They have one of the best lot of special any field of science. You should come here, and it has a very good ambience, and you feel relaxed and comfortable. So don't delay your treatment of your skin disease, but because other things can be treated, but it might not be too late for you. There are other options, lasers and all that, but ultimately there is nothing which cures the scar. So act timely, treat your acne, and be happy.